Hello, my name is Artur Valerievich and I teach anatomy. And today we're gonna speak about superior vena cava. Vena cava superior, it's a big vessel that actually originated on the level of first right rib in the point where unite two brachiocephalic veins, left and right, vena brachiocephalica sinistra and vena brachiocephalica dextra. Then vena cava superior and go down and opens to right atrium, to atrium dextrum of the heart. So it's short vessel and get blood from two brachiocephalic veins. Vena cava superior have actually one big tributary, vena azygos. In abdominal cavity, on posterior wall, you have some parietal veins that drain blood from the walls of abdominal cavity. And they called vena lumbalis ascendens, left and right. So if you talk about right one, vena lumbalis ascendens dextra, it go through diaphragm, get to the thoracic cavity and transforms into the vena azygos. It's called azygos vein. It go up, as you can see, until the level of fourth or fifth thoracic vertebra, then decline anteriorly, bend over the root of right lung, turn around the right principal bronchus principalis dexter, and fell into the vena cava superior. So what tributaries does vena azygos get? As you can see, it's a vena esophagealis, then will be vena also bronchialis, vena mediastinalis and vena pericardialis. If you talk about parietal branches, the main of them it's vena intercostalis posterioris. They similar to arteries you studied before, also arteria intercostalis posterioris. They accompany them. It's from 3rd till 11th intercostal veins, right one, because we also will have left one. They drain into another vessel. So right inferior 9 intercostal posterior veins fell into the vena azygos. They drain blood, as you may know, from intercostal muscles, membrane, but not only. Inside and outside of your canalis vertebralis, you have two big plexus. As you can see here, inside canal, it calls plexus venosus vertebralis internus, and outside you have big plexus vertebralis externus. We have external and internal vertebral plexus. These veins from internal and external vertebral plexus, they join and create these two vessels that calls vena intervertebralis. Intervertebral vein that go out of vertebral canal through opening foramen intervertebrale. There it get one more tributary vena dorsalis that drain blood from your skin of back and all muscles of back. And then it is intervertebral vein fell into the vena intercostalis posterior. So now you know that vena intercostalis posterioris drain blood not only from intercostal muscles and spaces, it also drain blood from your back and from your spinal cord and canalis vertebralis. But we described only right one. What about left side? From the left side we also have vena lumbalis ascendens sinistra that come to thoracic cavity and became and transforms to another vessel that calls vena hemiazygos. It's similar to azygos, and on the level of like 7th or 9th thoracic vertebra, it's declined to the right and fell into the vena azygos. It have the same tributaries, but left one. It have vena posterioris, sinistri, left one, but not all, from like 6th till 11th inferior, and also vena esophagealis, bronchialis, mediastinalis. But what about superior? We have one more vessel These intercostal veins, vena intercostalis posteriores, from like second, third, fourth, and fifth intercostal spaces, they unite into this vessel that calls vena hemiazygos accessoria. Vena hemiazygos accessoria that go down, also decline to the right, and as you can see, it fall into the azygos. It receives the same intercostal posterior veins. From first and second intercostal spaces, you have vena intercostalis superior that can fall into azygos or into brachicephalic. So vena azygos drain blood from almost all thoracic cavity, from its walls and internal organs, and also from posterior wall of abdominal cavity. We have two brachicephalic veins, vena brachicephalica dextra and sinistra. As you can see, right one it's short, left one it's long. Right one it's about 2.5–3 centimeters. Left one 2 times longer, like about 5 or 6 centimeters. They both originated behind articulatio sternoclavicularis from the unite of subclavian and internal jugular veins. Brachicephalic veins have a lot of tributaries. So you can divide them on like big tributaries and small tributaries. So if you talk about big veins, first of all, it's, as you can see, it's a vena thyroidea inferior thyroid vein that drain blood from thyroid gland, from thyroid plexus, left and right. Next one, it's deep cervical vein, vena cavea profunda or vena cervicalis profunda. Next one, it's vena vertebralis. It's originated in suboccipital region. It's a company arteria vertebralis in this foramina, processus transversus of cervical vertebrae, and go down and fall into brachicephalic vein. And it's internal thoracic vein, vena thoracica interna. It also have the same name as artery, remember. It's accompanied on anterior wall of thoracic cavity next to sternum, and it originated behind the cartilage of 7th rib. It's unite of epigastrica superior vein and vena musculophrenic. So vena epigastrica superior originated on the level of umbilicus. It's making anastomosis with inferior epigastric vein. We will talk about it later. It's go up on back side of musculus rectus abdominis. It's drain blood from rectus abdominis and its sheath, and then joined with musculophrenic. A musculophrenic vein, it's created by this veins from diaphragm, it's drain diaphragm, and intercostalis anterioris. Veins that anastomose with intercostalis posteriores, you know about it. Epigastrica superior and musculophrenica create thoracica interna, that go up, also get intercostalis anterioris, like from superior 5 intercostal spaces. It go up and fall into brachicephalic vein. It's big tributaries of brachicephalic vein. Also, it have a few small tributaries that are vena thymici from thymus, vena mediastinalis, vena bronchialis, and vena esophagealis. Now we're gonna talk about vena jugularis interna. All blood from your head and neck, it's drained by this vessel. Vena jugularis interna, it's straight continuation of sinus sigmoidus. Because you remember, sinus sigmoidus, it's come to foramen jugulare, and it's like fall into this foramen jugulare and actually became vena jugularis interna. Vena jugularis interna, it's originated from foramen jugulare of occipital bone, go down, it's situated on the neck, it go down behind the sternoclavicular joint. Vena jugularis interna unite with vena subclavian. And vena jugularis interna have a lot of tributaries, and you can divide them on intracranial and extracranial. So intracranial tributaries, actually it's all sinuses. So all this blood from all these sinuses, it's come to sinus sigmoidus. So where this blood came from? And first of all, you must know that they contain this blood actually from the dura mater. Next, cerebrospinal fluid also drain into the sinuses. Next, into the sinuses, they drain blood from your bones of skull, your skin of the head, and your orbital cavity. So we have few more veins that you must know. We have vena diploica frontalis here. It's draining into the sinus sagittalis superior. We have vena diploica temporalis anterior, that drain into sinus sphena parietalis. We have vena diploica temporalis posterior, that drain into vena emissaria mastoidea, and inconstant vena diploica occipitalis, and can drain into the sinus transversus. We also have emissary veins. What is emissary veins? Emissary vein, as you can see here, acts actually like anastomosis between your subcutaneous veins of the head and sinuses. And this vein drain blood from your skin of the head and aponeurosis and muscles from tissues of your head into the sinuses. We have few emissary veins. First of all, it's vena emissaria mastoidea that go through foramen mastoidum on your temporal bone and fall into the sinus transversus. Next is vena emissaria parietalis. It goes through foramen parietale in parietal bone and fall into the sinus sagittalis superior. And vena emissaria candilaris, we can see them, it will be there, that go through canalis candilaris of occipital bone and fall into the sinus sigmoidus. And also in constant here, it can be vena emissaria occipitalis, that is above foramen magnum, go through occipital bone and fall into the sinus transversus. Also, your sinuses get blood, drain blood from your orbital cavity. Inside orbit, we also have few veins. We have superior and inferior ophthalmic vein, vena ophthalmica superior and vena ophthalmica inferior. As you can see, superior ophthalmic vein originated like in the internal angle of eye from unite of supraorbital veins and vena dorsalis nasi. Also, it get blood from lacrimal gland at vena etmoidalis anterioris, etmoidalis posterioris, ciliaris posterioris, and the superior muscles of eye. Inferior ophthalmic vein get blood also from eye, from inferior muscles. Then they unite. Ophthalmic vein go through fissura orbitalis superior and fall into sinus cavernosus. Also, almost all blood from your brain drain into one big vessel, vena cerebri magna, or it have eponymical name, vena of Galen. This vein receive blood almost from all your brain. Almost all deep veins drain blood to vena cerebri magna. Some superficial veins can fall straight into sinus, but mostly all blood from your brain is drained into the vena galena that fall into sinus rectus. Now you know that your sinuses get blood from your dura mater, from another meanings, from your emissary veins, diploic veins, ophthalmic veins, cerebral veins, and also cerebrospinal fluid. And all this blood from all the sinuses, it's gathered into the sinus sigmoidus. And then sinus sigmoidus come to foramen jugulare, fall into it, and transforms into vena jugularis interna. And on the neck, we have few extracranial tributaries of vena jugularis interna. So, as you can see, first of all, it's vena occipitalis there, Next, it will be their vena pharyngealis. Actually, on posterior and back sides of pharynx, we have big plexus pharyngealis. So here's this vein drain blood from this plexus. Next, few veins are accompany arteries of the neck. You remember them, they have the same name, and they drain the same region that these arteries supply. So, for example, vena thyroidea superior, as you can see, go next to arteria thyroidea superior and drain blood from your thyroid gland, from muscles of larynx, from larynx. Next, we have vena facialis here, also accompany arteria facialis, and also originated in internal angle of eye, make anastomose with dorsalis nasi. It's vena angularis. It have tributaries: vena labialis superior, vena labialis inferior, vena transversa facii, vena nasalis externi, vena submentalis, and vena facialis fall into jugularis interna. Next, it's vena lingualis, also accompanying arteria lingualis, originated inside tongue. It have tributaries: vena profunda lingua, vena dorsalis lingua, vena sublingualis from the sublingual gland, and suprahyoidea here, and fall into the vena jugularis interna. Also, we have middle thyroid vein. You remember, we have superior, we have inferior that fall into brachicephalic vein. Also, we have vena thyroidea middle, vena thyroidea media, that fall into vena jugularis interna, and behind your parotid gland, behind the branch of mandible, we have this big vessel that calls vena retramandibularis. It's like a continuation of superficial temporal vein. So vena temporalis superficialis accompany artery, go down, and in front of your ear, it's joined with deep temporal veins, with transversa facii veins, and became vena retramandibularis. It go behind mandible, that's why it calls retramandibularis, behind parotid gland, go down, and, or as you can see, it can join with facial, or it can fall into jugularis interna on its own. It's drain pterygoid plexus. On the lateral wall of musculus pterygoidus lateralis, we have big plexus. Actually, plexus pterygoidus, it's similar, as you can see, to arteria maxillaris. Pterygoid plexus get all these tributaries that accompany branches of arteria maxillaris. From plexus pterygoidus, we have few big vessels, few big veins that can called vena maxillaris, that fall into the vena retramandibularis. So vena jugularis interna, it's deep vessel, deep vein, that gather blood from deep regions of your head and neck. But we have few superficial vein. So vena jugularis externa, it's originated on anterior, on the level of anterior margin of sternocleidomastoid muscles as a unite of branch of retromandibular vein and posterior auricular vein. As you can see, it goes down, it crosses sternocleidomastoid muscle, it go under the skin, go down into the fossa supraclavicularis major, and there it penetrates fossa and fall into the venous angle, angulus venosus. Venous angle actually is the place where jugularis interna and subclavia join. In this place, above the clavicle, it have few tributaries. It's as you can see here, it's vena transversa colli and vena suprascapularis. And also we have one more superficial vein that originated in your submental region. In trigonum submentale, we have few veins that joins into the vena jugularis anterior, or left and right. Anterior jugular vein go down. There can be anastomose between them. Nettor didn't draw it here, but it can be present here between left and right anterior jugular veins. It calls arcus venosus juguli here, and then they decline laterally and fall. Can fall to the venous angle, or into vena jugularis interna, or to vena brachicephalic. So that's all about veins of head and neck. So now, now you can see that almost all blood from your head and the neck, it's get to vena jugularis interna or brachicephalic. Subclavian vein, it's continuation of axillary vein, situated under the clavicle. It's laying on first rib. In front of musculus scalenus anterior, we have spatium antescalenum. We have vena subclavia laying in this space. Vena subclavia have the same tributaries as the arterial subclavia have branches. Now we're going to speak about veins of upper limb. Veins of upper limb are divided into deep and superficial. So they all begins on the tip of your fingers of hand from proper digital veins, palmar and dorsal. So you have vena digitalis palmaris and dorsalis from the backside. They join and create vena metacarpalis, palmaris and dorsalis, and create arc. Will be arcus venosus palmaris profundus and arcus venosus palmaris superficialis, and they join and create two pair of veins, because deep veins, two veins accompany one artery. So we have two ulnar veins, vena ulnaris, and two radial veins, vena radialis, that accompany the same arteries. They go up, unite, and create two vena brachialis. You have two brachial veins that go up and like in the middle of arm, they join into one vena brachialis that crosses inferior margin of pectoralis major and transforms into vena axillaris. But superficial. On the back side of your hand, you have plexus venosus dorsalis manus. You have venous plexus that actually created by the dorsal digital veins, vena digitalis, dorsalis, and metacarpalis. From this plexus, you have the beginning of lateral and medial veins of forearm, subcutaneous veins. So they called vena cephalica and vena basilica. So lateral one, it's vena cephalica. It's, as you can see, it's laying on lateral part of antebrachium of forearm, go up into the fossa cubiti, then it go to the arm. It's laying in lateral bicipital groove, sulcus bicipitalis lateralis, then it's go into the sulcus deltoide pectoralis, and in fossa infraclavicularis, this is infraclavicular fossa, it go deep and fall into the vena axillaris here. Middle one, it calls vena basilica. So basilic vein begins from the middle part of your dorsal plexus of the hand. It also go on anterior part of forearm, then in the cubital fossa, then decline medially and laying in medial bicipital groove, sulcus bicipitalis medialis, and there it penetrate fossa, go deep and fall into the vena brachialis. The most interesting in this part, it's we have anastomose between them. There are a lot of variations of this anastomosis, and all of you have different anastomose. In some cases, there can be middle antebrachial vein, vena antebrachii here, that go up and divides into branches, and one fall into the basilica, another fall into cephalica vein. In some cases, we have just one anastomose between cephalic and basilic vein, and on the level of cubital fossa, and it calls vena mediana cubiti. Brachial vein on the level of inferior margin of pectoralis major became vena axillaris, that then will transform to vena subclavia. Vena axillaris have few tributaries, more superficial vein that originated, like also in the region of umbilicus, it's vena thoraca epigastrica. Here is thoraca epigastric vein. It originated in subcutaneous fat tissue, go up and fall into axillary vein. So this is the difference between axillary artery and vein. It have this tributary vena thoraca epigastric. As you can see, it get lateral mammary veins, and it may anastomose with superficial epigastric vein, vena epigastrica superficialis. It's tributary of femoral vein. We will talk about it later. And then again on the external margin of first rib, vena axillaris became vena subclavian. Then subclavian vein unite with internal jugular vein, became brachicephalic vein, and then left and right brachicephalic vein unite and became vena cava superior, and then vena cava superior fall into the right atrium, atrium dextrum. So thank you for your attention, subscribe channel, ask questions, and see you later. Peace.